Discontinuation of peripheral IV sites. Different nursing assessments that may indicate the need to discontinue a site would include infiltration. The site is red, tender, indurated, or warm to touch. Evidence of thrombophlebitis. The vein might be hard and tortuous. The patient complains about aching of the extremity. Site infection evidenced by drainage. There might be some cannula occlusion, evidence of cellulitis, suspected IV-related sepsis. There might be, when discontinuing an IV site, there are some principles that you need to follow. These here that are listed, but with scissors can result in digit amputation in infants, an accidental skin laceration or accidental severing of some catheters. A description of the site when you discontinue the site is necessary in the patient's medical record. When the cannula is removed, then you'll hold dry, sterile sponge over the insertion site and then smoothly remove the cannula itself. When achieving hemostasis, make sure that you use the dry, sterile sponge to apply instant but firm pressure with the extremity elevated above the heart level. Don't rub the site, and avoid using the alcohol pad because alcohol stings and it can also promote bleeding. Continue to apply pressure until complete hemostasis has occurred. With the dressing, make sure that you apply a dry, sterile dressing to the site. Unless specified by facility policy or procedure, it's not recommended that you use Band-Aids. Inspect the cannula after you remove it. Determine if the length of the cannula removed corresponds with the length that was inserted as noted on the original site dressing, and visually determine that the catheter tip is not jagged. Dispose of contaminated equipment and rubbish according to established facility protocol. Many nurses like to dispose of removed IV cannulas in the sharps box, but these are very flexible and pliable, and as you're trying to push those into an IV sharps box, you can accidentally puncture yourself with a used needle. So make sure that you use the appropriate biohazard disposal system. Then remove the gloves and wash your hand. In providing instructions to the patient, these are listed here. Make sure that again, you always document the education that you provide the patient in the patient's medical record. If you didn't document it, you did not do it.